Hello everyone, my name is Monica Martin and I'm the Director of Staff Education at West Hartford Health and Rehab Center. Today, what I will be doing is reviewing with you an educational tool, our welcome orientation packet for our patients. I will be reviewing this with you and I will be demonstrating how to utilize this tool in an educational setting. So first of all, after you've completed this seminar or this video, I want you to be able to identify what the welcome orientation packet is, who it is used on, and I also want you to know why it's important. Okay, so those are the three objectives of the video. So first and foremost, I have put the tool, which is this laminated PowerPoint that we use in my facility as the backdrop of my video because you'll be able to clearly see it. We take this tool and we've laminated it for infection control purposes. We can wipe it down, but also it's very cost effective if you need to change names and information on the PowerPoint. So on the first slide, it's just an introduction. So what we do is we go into the patient's room and we say, "Hi, I am Monica. Welcome to West Hartford Health and Rehab Center. I have a packet that I would like to review with you. It's just a little bit of information about our facility so that you will have a better understanding of where you are and what's going to happen while you're here." It gives them a little bit of an understanding of where they are and what's going to happen. So the first slide, we introduce Teresa Sanderson, who is our administrator. So I explain to the patient through demonstration that this is Teresa. She's the administrator of our facility, which is on the bottom right here. And it's a big clear picture of her so that they know who she is. We have given this to them so they can identify who they can contact in case of emergency or a situation. So I tell her Teresa's administrator, she handles all of the issues in the facility. If there's something that you cannot have addressed, she is the person that you can go to. She takes pride in what she does here, and if you have any questions, comments, concerns, she's the person that can help you facility-wide with anything or anyone. The next slide is going to be our mission. It kind of gives the patient more of an understanding of what our goals are. It all talks about quality of care and patient-centered care because it's all about the patient. And we tell them that, our job here is to make you better. We're on unfortunate terms, you're here, but our job is to do what we can to get you to the best of your ability. So please, if there's anything we don't have, we don't know, please take that time to tell us when we're going over the mission statement. The next is the facility visiting hours. We discuss with the patient, we're open 24 hours, 7 days a week. However, we would like you to use the front entrance from 8 a.m. to 8 p.m. And if they had any concerns about family members coming in to visit, well, at that point, we can make special arrangements with them. And if they have any questions, again, we have it there for them to speak with the supervisor. We talk about nearby hospitals. At my facility, we are a preferred provider for UConn, St. Francis, and Hartford Hospital, but there are other hospitals that patients come to. Again, there's information in here that goes over the different types of hospitals and where they're nearby. Because sometimes patients come in and their family aren't happy with the visits that they've had. So this is why this is important. And it's important to tell them that they have options. They have their rights, but they also have options to their care. So they don't feel like they're just stuck with what they went through. Okay, it's very important for them to understand that. The next slide talks about our director of nurses, which is Bonnie Horwitz. She's the director of nurses. We review with them. This is Bonnie. She's in charge of the nursing department. If you have any questions regarding to your nursing care, she's the person to speak with. We want them to know these two people and have these individuals to be able to identify on their slides so that they're able to identify who they are if they bump into them or if they have any questions. We present meal times, so meals are 7:20 a.m. and 8:20 a.m. depending on what side of the unit they're on, and we go over and explain that. If you're on the A side, your breakfast starts at 7:20. If you're on the B side, it starts between probably 7:30 and 8:25. The lunch times are also there and the dinner so that they can refer to if they're hungry. We also tell them that if there's any issues they have with hunger, just to give us let us know and we'll get you a snack if that doesn't work for you, or if you want your meal a different time, just let us know. television guide with all the channels because it's important while you're sitting there, you know what you can watch on TV. Also, this PowerPoint is flashing on the television screen for them. So if they drop it or lose it or for some reason can't get to it or a family member isn't there, we do try to review it with them. But if a family walks in the room 2 hours later, it is available on the TV as a screensaver. So if anything should happen, they have the information still available to them. Laundry services are important to someone who's coming into the facility. They want to know where my clothes go, when they come back, what happens to them, do I have to label them? Just basic questions, the stuff that we take advantage of all the time. We know the answers to these questions. We have systems in place. They're embedded into us as nurses, but sometimes the patients do not. So it's a good idea for you to review with them just the basic concepts of what's going to happen with their laundry. Next is talking about evaluations and discharges and talking about we start the evaluation process as soon as they come into the facility. So we're going to tell them, after I'm done reviewing this power packet with you or this orientation booklet, your nurse is going to come in and she's going to start assessing you to make sure the hospital didn't have any issues identifying anything, such as like there might be a boo-boo on your wrist or an area on your back or something like that, depending on the mental status of the patient and how you're going to talk to them. When we have patients that are at a intellectual level that's lower, we're going to, be more kind to them, more giving less medical terminology. And then when you have somebody who's a little bit more in control of their care, we're going to use more medical terminology to help describe and relate the situation for them. And then the next one, we identify we are a non-smoking facility. You cannot smoke here. There's no smoking items here. This is very important to us. We don't want someone to come in and say, well, we didn't know it was non-smoking and set our building on fire, because obviously in my facility with 160 patients, we want them to know they are not allowed to smoke. If they smoke, they will get a letter to discharge them, and they have 30 days to find a new location to go to. So that's it. There's no cigarettes, lighters, matches, or other equipment for smoking allowed in the facility. And then at the end, there is a list of all of our department heads. It is our names and what we do. And we go over one by one with the individual or the patient who they are and what they do. So you can say Ines is the assistant director. She helps Bonnie. And Kristen Murphy is the admissions director. So if you have any questions about your stay or transfer from the hospital, she's the person you can contact. We go over Sophia Rodriguez. She's our human resource person that helps with our employee relations. We talk about the social workers and what their role is. They help you with any type of equipment or any needs that you have when you go home. If you have any questions, we have two wonderful social workers. We talk about the rehab director, how long he's been here. He's worked for us for over 5 years. They have rehab on Saturdays. He is the manager and the department head. If you have any questions, you can speak with him. And then we go through the nursing department and the other side of the building one by one, and talk about who everybody is and what their role is. This is a lot of information to give to a patient when they first walk through the door, especially when they're not feeling well. This gives the nurse the opportunity and time to do some basic assessments while she's reviewing the basics of our facility. So if a patient is not feeling well, you can kind of identify they look like they have the chills. They're not feeling good. They're nauseous. They don't want to eat. They're short of breath. It gives the nurse an opportunity to do some basic assessments while they're sitting there and explaining to them who we are and what we do and what to expect while they're staying in our facility. So again, we go over, take the packet, we go to the bedside, we review the information with the patient. We leave this hanging on their board or right next to them for them to review it. Again, if they drop it, it's accessible on the television screen. And then at the end of reviewing this packet, we explain to them we're going to come back in one day to see if you have any further questions or if there's anything that you need from us that we didn't review. If there's something trending that the patients say, hey, I need it, I want it, we add it to the PowerPoint. We add it, we laminate it, we send them out to the other rooms on the rehab unit. We're doing this because we want to give information to our patients to have them transition. A lot of times the reason for this was that patients do not understand what's going to happen when they get out of the hospital and they come into a long-term care stay. So this was designed to assist them in understanding the basics of what's going to happen. If there's anything that needs to be changed or added, it's cost effective because it's just laminated sheets that can be added and changed. So the tool is very cost effective and it's very easy. Another reason why we do this is we get the nurses in the habit of educating the patients. You have LPNs and RNs who have no idea how to educate. They have no idea the basics, the tools, the teaching methods. So this was designed to have them easily be able to read it, understand it, and then return demonstration and give it to the patient and have us watch them from a distance to see how they're interacting with the patients. It increases customer service, it increases patient-centered outcomes, and again, welcome booklet is for the patient, and it was designed in order for the patient to have better patient-centered care outcomes and feel more in control of their stay. So that is my video. I hope you enjoyed it. I look forward to anybody giving me any feedback on this, and I hope you all have a great day.